Welcome to Jersey Matters. I'm Larry Mendte. On this week's show, COVID-19 vaccines are arriving in New Jersey, and healthcare facilities are scrambling to get doses. The chief medical officer at CentraState isn't even sure he will get any. Assembly Minority Leader John Bramnick tells us why he has decided not to run for governor. We've already had one snowfall, and more are certain to follow. A spokesperson for JCP&L says they're ready for anything. And red kettles mean it's getting to look a lot like Christmas. We'll talk to the Salvation Army about protecting bell ringers in a pandemic. But first, my interview with Dr. James Matera, Senior Vice President and Chief Medical Officer at CentraState Healthcare System in Freehold. Doctor, I know this is a busy time for you, so thanks so much for your time. Let's talk about the Pfizer vaccine, because that's the first one that is expected to be approved. As a matter of fact, by the time this airs, it may have been approved by the FDA, and people may be getting it already. Will you have the vaccine? Because I saw a list from the state with 6 hospitals, and CentraState was not on that list.
Correct. We anticipate we will get vaccine, but we just don't know right now. So the list that came out is mostly the larger systems throughout New Jersey, but we have struck a clinical affiliation with Atlantic up in Morristown during the pandemic. Actually, this has been work we've been doing for a number of years. But we have indications that we will be getting the vaccine. We have the capability of storing it at the correct temperatures. We did buy that equipment. So we still don't know if it's going to be something we'll have to get from one of the other facilities like Atlantic, or if we'll get directly from New Jersey.
For people that want to come to CentraState to get the vaccine, what do they do if they don't even know if you're going to have it?
Well, during the first wave, it's going to be mostly employees and healthcare professionals. There may be some available for the general public, but the general public is not in this first wave of vaccines, purely because the number of vaccines that we're expected to get won't be enough to go ahead and vaccinate out in the community. So New Jersey has taken the stance where they're going to recommend healthcare workers and long-term care facilities be prioritized. The general public will come in the second or third wave of the vaccines. And most of what I'm hearing is the general public sometime in the spring to early summer will be more mass vaccinations. Just looking at our employees and our medical staff, we have quite a few there. We want to make sure that they're all vaccinated as well.
And you're treating COVID-19 patients, right?
Correct. So
it seems odd, it almost seems evil that you wouldn't get the vaccine if you have healthcare employees that are treating people with COVID-19.
Yeah, the target for the state, though, is to, during this first wave, to make sure that all high-risk long-term care facility patients, because we know what happened in the spring with that, and healthcare providers and healthcare workers are vaccinated. And there should be enough vaccine over time. It's not like we're going to get everything we need for the state next week. So this may be a staggered process. And as you know, it's a 2-dose vaccine. So the Pfizer product, after the first dose, after about 21 days, you have to receive the booster dose or the final dose in order to confer the best immunity possible.
If you're thinking you're going to make an appointment to get this vaccine, you're probably not.
Yeah, not at this point. It'll depend on what the numbers are. For our employed staff, we do have a process in place which they can register, and we will have vaccine stations set up to be able to provide the vaccine. And there's a lot that goes with that. This vaccine, as you know, has to be kept, the Pfizer one in particular, super cold, down to as much as minus 80 degrees. It then has to be rewarmed, constituted, and used at during a finite period of time. And with this being almost liquid gold, we don't want to waste any. So we have contingency to make sure that no vaccine is going to be wasted as well.
So if you have an appointment, you have to make it. There's nothing. Maybe you should show up 6 hours earlier. I'm not going to tell you how to do your job. You need someone there.
Yeah, we're stressing that we want to make sure that all the vaccine that we have, that we do get, and what we get that gets reconstituted is given directly into the arms of our population.
We should also point out, we talked about Moderna, we talked about Pfizer, AstraZeneca. Just today, they confirmed the efficacy of 90%. And so that sounds like that's quickly behind. We might have 3 vaccines before the end of the year. So probably getting the vaccine is not going to be a problem for you or hospitals or healthcare workers. But you were amazingly calm about this, which makes me believe you have every belief, even though it hasn't been confirmed, you're going to have this vaccine for your workers.
That is my hope, and I know for a fact we have the process in place where we can it's almost a turnkey. As soon as we know what we're getting, we can schedule that many vaccines. And let's just use an arbitrary number of 1,000. If we get 1,000 vaccines and we only had to vaccinate 800, then that extra 200 could potentially go into the population or to other places that need it for healthcare workers. So we have all these contingency plans in place. But as soon as we know what the N is, the number, we'll be able to turn the key and get the vaccinations going.
You keep hearing these reports, even from hospitals in New Jersey, that up to 40% of healthcare workers at these hospitals don't want the vaccine when it first comes out because they don't trust it. Are you realizing those numbers at your hospital?
Yeah, we've done some polls of our medical staff, and it's about 40 to 50%, roughly half that would agree to the vaccine. I think a lot of it is fear right now. And I think once you start to see people getting vaccinated, yes, there are side effects with the vaccine. They've been reported, usually after the second dose with these first 2 vaccines that are coming out. But I think you'll see healthcare workers start to engage to it. Now, on a physician side, our numbers were a little bit higher for those that would want to take the vaccine. But yeah, we struggle with that as well because, we don't know, we're not making it mandatory. And we don't know how many workers will take it. A lot of it has to do with fear. A lot of it has to do with the unknown. A lot of it has to do with the fact that these vaccines were developed so rapidly. But that's actually not a bad thing because this type of vaccine, which is a genetic vaccine, there's no infectious material in the Pfizer or Moderna products at all. They can be ramped up a little bit faster. So I think the science behind these is pretty solid.
It's interesting. We're talking about something that's a very short-term problem if you don't have the vaccine, because it seems like we're going to have so many vaccines and a big supply of it within the month. Yeah. And so even if you don't get this first batch, I would imagine you're pretty confident you're going to have it shortly after that.
Yeah, I think we're going to have to go over the first signs of chaos, which will be who gets the first tranches of the vaccine. And then ultimately there will be enough, we're hoping, for everyone who desires the vaccine, and I would encourage it to get the vaccine. But it will be chaos.
When we were setting up for the interview, you said something that's very important, and I'm not sure if you reiterated it, but I think it was important, is that you said if you get the Pfizer vaccine, stay with the Pfizer vaccine. If you get the Moderna vaccine, stay with the Moderna vaccine. You can't mix them up.
Yeah, it's not a good idea because while they're both mRNA vaccines, there's subtle differences. One in the storage temperatures, another one in how it's reconstituted, and a little bit difference in the side effect profiles. You may have heard Moderna talk about that a little bit. Fever, for instance, hasn't been reported very highly with the Moderna where it is with the Pfizer. So I think it's a good idea to stick with the same product. So our goal would be everybody who gets the Pfizer vaccine scheduled about 20, you have to wait about 21 days for Pfizer, 28 days for the second of the Moderna, to try to get them scheduled, because we also know giving that first dose of the vaccine and the person doesn't come back for their second dose, you've essentially wasted a dose of vaccine. You need both to confer whatever the immunity may be. And remember, we don't know what the long-term immunity is going to be for these, whether this will be a waxing and waning immunity that has to be revaccinated every year. Those things will follow in time. We don't need to know that right now.
From this interview alone, I can tell you have a very good bedside manner, and I really appreciate talking with you. I hope you get the vaccine quickly for you and your workers and your patients, and I'd love to talk to you again soon.
Thank you. It's my pleasure.
That was Dr. James Matera of CentraState Healthcare System. When we come back, the minority leader in the New Jersey Assembly, John Bramnick, decides not to run for governor. He'll explain when Jersey Matters comes right back.